Welcome to Skin to It. I'm Marlo Sutton, fashion stylist and beauty enthusiast.
And I'm Dr. Sandy Skotnicki, board-certified dermatologist.
So today we are going to tackle what you can do before you see a doctor for hair loss or before prescription medications.
And I think we're going to focus a little bit on women with this episode because we have another full episode, our first actually, just for men. So before we get started.
As we should.
What's that?
As we should.
As we should. Before we get started, I want to thank our sponsor for this episode, Ducray. Ducray is a dermocosmetic brand developed by Pierre Fabre, focused on research-driven care for scalp health and hair thinning. Their formulations are designed to support the hair follicle environment and complement medical treatments. From a dermatology perspective, hair loss is rarely just one solution. It's about consistency and combining approaches. Dermocosmetic products like Ducray can be useful additions for patients looking to support overall scalp and hair health. So,
amazing.
Yeah.
So I guess my first question for you, Sandy, is it, we've done a couple of episodes now on hair loss for men and women, and it's obviously very top of mind. Is it? Is it?
Yeah. So when we were prepping for this, we talked about this, and I actually did some research. So first of all, do you remember when you were pregnant and then everybody seemed like they were pregnant?
Sure.
Or you get a gray car and then it's actually the most common color of car, apparently. But it's that kind of awareness. So it's not statistically any more common, but we do see it more in the office, and we have more people wanting to come in to talk about hair loss, because it's just so top of mind. I mean, really, that's been driven a lot by social media.
Sure.
And then the Zoom culture. People, like, you see yourself, nobody really looks at themselves that much. But on Zoom, you're constantly going, wow, is that what I really look like? And you see your hair and you see your chin. And so it's that. Funny. It's also celebs. There's less stigma about it. People talk about infertility or sexual dysfunction or hair loss. Like the stigma is sort of gone.
It's lifted.
And young people are talking about it.
I mean, let's be real. When we see celebrities on the red carpet and in photographs in general, they all have wigs and pieces.
Oh sure.
Yeah.
Oh sure they do. Yeah.
But I think that is something people didn't realize.
Yeah. And it's nice. It's refreshing when sometimes they actually talk about that. Like they say, okay, I have this little piece, or my ponytail has an extra. Actually, one thing I wanted to mention about the awareness is I did a quick ChatGPT 5. So I have the professional one. Google searches for the term hair loss, over 1 million a month.
Okay.
And 262,000 TikTok videos on something to do with hair loss, accounting to about over 9 billion views.
Right.
So it is awareness, not necessarily an increase in hair loss.
So what are the most common causes of chronic hair loss in women? And actually, if you can go back to in season 1, we really did a deep dive on hair loss.
Yeah.
And we did Scalps 101 in our season 2 of Skin to It. Yeah. So let's just recap on the most common causes.
Yeah, I think if you want to really take a deep dive, listen to the hair loss 101, the scalp 101, and then this one.
Yeah.
Because it's kind of a great segue. Because we try to keep each episode under 20 to 30 minutes for people, because we think that's great. Well, the most common cause of hair loss is this sort of female pattern, male pattern. So it's just thinning as we age. Right? It's the same thing that men get. It's called androgenetic alopecia. And what's happening is your hair follicles are miniaturizing and shrinking, mostly due to something called dihydroxytestosterone, which we're going to get into a little bit.
Okay.
Statistically, women in their 20s, about 3 to 12% of women. So we do see it sometimes in young women.
Yeah.
29% in women in their 50s. And then as you get older, into your 70s, you can really thin out. So about 56% of women. So it's a gradual thing that happens as we age. And some of that is determined by genetics. The second most common, and these are really the two we're going to focus on, is the shedding of the hair, which is telogen and effluvium, which I know you've experienced.
I have.
So, and I'd love you to recount that story again for the listeners. But those are the two main causes of hair loss, and the majority of what's bringing people in to see doctors.
Yeah. Yeah. With the thinning, you don't expect it to happen, and it almost feels like it happens overnight.
Yeah. It just falls out.
it just falls. And then all of a sudden, I was trying to do a ponytail and I was like, oh my gosh, what happened? And then you go into a little bit of a panic.
Yes.
And, I remember calling you and talking to you about it and you saying, listen, it will, if you just had a shed, it could be, stress and hormones and all these different kinds of issues, which we could discuss. But it should come back, and it has. I mean, it for the most part, it has. But it really takes.
Actually, I'll tell you what I tell patients. So when telogen effluvium, which is the hair shedding, which you experience, and I've experienced. I've had 3 kids, several surgeries, and so I kind of explain it to patients like you don't need hair to survive.
Right.
So when your body is under duress, like you've had a major operation, just the anesthetic even, car accident, death in the family, some COVID, we saw lots of hair shedding in COVID.
Right.
And then your body kind of shuts down and it pushes follicles into a rest phase to conserve energy.
Wow.
Because you need energy to grow hair. So if you put it into, you shove your follicles into what we call a telogen phase, then you kind of, your body's shutting down. So it's a response to that kind of a situation. And, it's not loss. It's just a shed and then it comes back. But it can take like 6 months to 9 months to grow back.
Sure.
So one last thing, there was a great article in the, I think we talked about it in the New York Times, or maybe it was the New Yorker. The title, and she's a great science writer, I can't remember her name. The title was The Year America Lost Its Hair.
Right.
And that was COVID, like the year after COVID, because it was so stressful. So many people shed. And we were bombarded as dermatologists with people, I lost half my hair. Can you see me? So that's telogen effluvium.
Yeah. So you mentioned a couple of different conditions. You mentioned androgen alopecia and telogen effluvium. And so can women actually have both conditions at the same time?
That's a good question because that's actually what happens is people that have they're younger, they have mild sort of the age thinning, the androgenetic alopecia that men and women get as they get older. And then they have a shed. And it kind of uncovers the fact that they have some mild androgenetic alopecia.
Okay.
So it actually manifests even worse. Like they'll say, well, I really see my scalp in the center of my scalp.
Right.
So yes, you can definitely have both. Most people often have both because if we just looked at the statistics I went over, a lot of people have mild androgenetic alopecia when they're younger. So
and we're treating that differently, which we're going to
get
talk
into.
About.
Yep.
Okay. So there, unless on TikTok now, but
keep saying that.
There's people online who aren't doctors, medical doctors, who are trichologists.
Trichologists, yeah.
Who deal with hair and hair loss.
Trich is the Latin term for hair. So yeah, trichologists are not medical trained necessarily. Some of them can be. I don't actually know. I don't know that much about them. I have had some patients who have gone to see them before they get into the dermatologist because it's a long wait to see the dermatologist. Sure. And some of them have given them great information and some of them haven't. So I think you just think it's a bit of a trend, trichologist, and people will say, should I see a trichologist? I'm like, well, you can see them if you can't see a doctor, but I don't know what kind of advice you're going to get. I'd like to think that most of the time they're well trained.
Yeah.
But I can't guarantee that.
Yeah.
So
I think it's a trend. They're just focused on the hair. So yeah, I mean, from the ones that I've seen, there doesn't seem like they are giving out, anything crazy like.
No, I think for the most part, it's filling a need, right?
Sure.
People want to have more scientific information from somebody who's knowledgeable. So just as with anything, buyer beware.
Right.
Because you have to pay for those. That's not covered under any kind of drug plan or OHIP
or anything.
You'd have to pay.
Okay, makes sense. So if someone's noticing hair loss, they're waiting a long time to get in to see a dermatologist, hopefully not too long.
Yeah.
Let's talk about, the things that they can do.
Well, I think that's why we wanted to do this episode. And also thanks to our sponsor, because they have some dermocosmetic products that we're going to touch on because it is hard to sometimes, and sometimes people, they just want to start something. They just want to do something. So the number one thing, listeners, that you can do before you see a doctor is minoxidil 2% or 5%. I mean, it's available at the drugstore. It has the most scientific studies that have proven to show increased hair growth in both women and men. So it's basically a no-brainer. The problem with the minoxidil is it's, and the trade name is Rogaine, is it's a foam. It's expensive. You have to use it every day. It can mess up your hair a bit, although the foam is not so bad. And a lot of people just don't like it. Right. But it is like, if you have, like, rather than going to a trichologist and getting some serums, or go get minoxidil. It works.
There's now for men and for women.
Yeah, so let's talk about that. The men's box is blue. The women's box is kind of a purpley mauve. They're the same damn thing, okay? It's 5% minoxidil.
So are we paying pink tax for the women?
I don't know if it's more expensive. I think they're pretty similar because people have figured that out. And women in the clinical studies, it's once a day, and men, it's twice a day.
Okay.
And that's written on the package. But if you can't, I tell my patients, if you can't find the purple box, get the blue box.
Just get the blue box.
It's the same thing.
It's the same.
And sometimes they have them at Costco and online, and so you can buy them as 3 and they're cheaper. Okay. So those kinds of, deals.
Look out for that.
Yeah.
Okay, so there's also a category of products that dermatologists sometimes recommend. So in between sort of the cosmetic hair treatments and
so that's where Ducray comes in,
right?
So
so talk to us about
Ducray. You talked to us as well, because Ducray was very generous, and they sent us their whole kit, which we have here. If you happen to be watching a video, you can see it. So they have a whole line for hair loss. And I'll just digress for a second and say that I got the opportunity to go visit the Ducray labs in France.
Amazing.
So Pierre Fabre is the parent company, and Pierre was a pharmacist, kind of the same time as all the other pharmacy-driven dermocosmetic brands like La Roche-Posay and Avène and Bioderma. And he bought Ducray early in his career and sort of really developed it into focusing on hair. Yeah. They also have skin care as well, but the hair is really their focus. And so we got 4 products. And so it's a suite. It's a shampoo and a phase shampoo. And then they have a serum, which is neoptide, and then they have capsules, which are kind of similar to some of the other supplement capsules like Nutrafol or Visical. And so it's a whole thing you could start. And I used to sell it in my old office. Yeah. A lot of dermatologists sell it because we know that it's got science behind it. We're going to talk a little bit about that. Yeah. But how was your experience using it?
Yeah, great. I mean, listen, I've only been using it for a few months, so I'm going to give it obviously a bit more time. But my hair has definitely come back, and it's, the products seem to be working really beautifully. Yeah, like and the shampoos, it's gentle. Everything is giving me just, when my hair was really thinned out, it had that lifeless feel. And definitely when I use the products, it's like my hair has got its bounce back.
Yeah. And we'll talk a little bit about the science behind it. And they have done quite a bit of studies, which is interesting. And we'll chat about those. But for me, I have used the shampoo on and off. I've given it to my sons because, actually funny story, when my eldest son is 26 and he started asking me a few years ago, Mom, can you see my friends? They have hair loss and they want to come in and talk to you about what to do. And I've probably seen at least half a dozen of them. Right. And, so I've recommended I give it to them. I give the shampoos to my sons as well. I use the serum. Yeah, I like the serum. It's elegant. And the shampoos are elegant too, because some medicated shampoos are kind of not so nice.
Yeah. Well, that's what I'm saying. It's like when you use them, and if I style my hair or even just leave it curly, it gives that suppleness back. Yeah.
Well, let's sort of dive into a little bit let's talk about, because the shampoos are kind of supportive. They have some B vitamins, zinc, biotin. We're going to go through the supplements. Biotin is a strengthener, doesn't grow. So that's basically the shampoos. And there's also a thing about shampoo, when I talk about shampoos with other conditions with patients, it's like, do no harm, right? So the shampoo will help, but it's also not going to irritate your scalp, because inflammation of the scalp can aggravate hair loss. Sure. So the shampoos are sort of good maintenance, nice, good supportive. The serum, so a couple things about the serum. Ducray has this sort of, they look at plants and see what they can derive from plants to help with the skin or the hair. So all of these ingredients that are in this line come from milk thistle, which is interesting. Yeah. And they've done something that is called in vitro studies. So an in vitro it's like in a petri dish or in a lab. It's not in a necessarily like a person, although they've done those studies as well. So they isolated 2 ingredients. One's called anchorin, which helps stimulate the follicle bulb And it actually they've compared it to sort of a minoxidil. It helps with the anagen phase or the growth phase.
Okay.
And then another ingredient called lespedenza, which kind of decreases the hormone DHT in the follicle. So the serum, they've actually compared it to 2% minoxidil. They did a controlled trial, and it was comparable.
Okay.
Yeah.
Amazing.
So, yeah.
And what about, you mentioned creastin?
Yeah, creastin is the other product. I haven't used that much, and that's the one that they kind of target for people that are having shedding. Okay. So it's also a very nice, elegant formulation, and it has things like peptides, vitamin B, the creatine, which stimulates the growth of the bulb. So again, it's a supportive thing while you're going through a shed. You want to use something, you can't get to the doctor, get it, and there's studies to show that it helps decrease shedding. They have, let me see, yes, they did a randomized controlled 100 women showing decreased shedding. And if anybody wants to find out more about randomized controlled trials, we did a great episode on clinical trials, so you can understand. So basically, a double blind means the investigator and the patient doesn't know what they're taking. It's randomized, so they put people into different categories. And that's the epitome of a good study. So they did a study with creastin, and they showed decreased shedding. So the nice thing about Ducray is they do back up their ingredients and their products with some clinical studies. They're in-house, they're small, but it's better than nothing.
Oh, well, a lot better.
Yeah.
Yeah. So you're calling them supportive treatments, which is a great way to talk about it.
Mm-hmm.
And I mean, I'm guessing if you are just having a shed and you don't have any other maybe symptoms, this will just help rebuild that hair.
Yeah, I mean, you can't get to the doctor, go get some Rogaine if you can afford it, if it doesn't mess up your hairstyle, because it's different for everybody.
Yeah.
And get the supportive line. And that's what, I mean, you're going to make a big difference there. You make a big impact before you get to the physician or the dermatologist.
Okay, I love it. So can we talk about supplements?
Yes, supplements. We couldn't do this episode without talking about supplements, because what happens when you have a problem? You go to TikTok, you go to the internet, and everybody's telling you to take, this and that. And so let's break them all down. I mean, as far as a systematic review by JAMA Dermatology. So JAMA is the Journal of American Medical Association. It's a great journal.
Yeah.
They have a dermatology one. And
it's not a magazine, it's a journal.
Yes, exactly. They did a great review because this is a question that we get asked as doctors all the time, what supplements should I use? So the only ones that really showed, first of all, they're all small, they're not industry sponsored because it's not a drug.
Yeah.
But the ones that showed some help or some is iron, vitamin D, zinc, and B vitamin.
Okay.
Biotin doesn't grow hair. It strengthens hair.
Okay.
But it doesn't grow hair.
Okay. So these are things if you just want to just to keep the hair you have. Maybe.
Yeah, I mean, again, you're going through
or
a shed.
strengthen the hair you have.
Yeah. You're going through a shed. Your hair's thinning. You can, they sell that you can buy these hair supplements that are ridiculously expensive, like, iron, vitamin D, zinc, biotin. So they're in the capsules from Ducray, the anaphase capsules.
What about like natural oils? Like, we see so many, rosemary oil and all these different oils that you see people.
Well, I wanted to say one thing I forgot about biotin before I get to the oils is like the biotin that's in these products is low. Mm-hmm. But if you read online and some TikToks, so you need a high dose of biotin. The problem with taking a really high dose of biotin, first of all, it's not going to grow hair. It's going to make your hair stronger. But it can interfere with blood tests, in particular thyroid and heart, some cardiac tests. So I just wanted to make sure I mentioned that.
That's so scary.
Yeah.
So, I mean, you should always tell your doctor that you're seeing, a dermatologist or family doctor, what you're taking.
You should, because supplements can affect, like when we do injections that can bruise people if they are on St. John's wort or ginkgo, that they're blood thinners.
Okay.
And, I've had people bruise much more readily when they take those medications and those supplements. And those are things that are recommended if you have heart disease or supplement with these natural things. And they actually have some great data, but they can thin your blood and you can bruise more.
Right.
So supplements are important to discuss with or tell your physician that you're on.
Okay. And what about doing IVs?
Yes. So I've started to do IVs in my office because I was frustrated. back to telogen and effluvium. One of the most important things for telogen and effluvium is having adequate iron levels.
Okay.
So we know that women that have low iron, they can prolong their shed. So I kind of think of iron like the soil. So you've lost the follicle. It's gone through a shed. You want it to regrow. You need the right soil.
Okay.
And if your iron is low, and a lot of women are low normal because we menstruate, or if you're vegan, and it takes a long time to move your iron stores or your iron level because you're menstruating every month.
Okay.
So I find an iron infusion and getting the iron up really quickly can pop people out of a shed.
Okay.
So we've started to do them in my new clinic.
Nice.
Yeah.
Okay. Cool. Wait, let's get back to oils because we didn't really talk. We didn't
finish that.
We didn't finish that one.
Well,
because I think that's also, again, huge on social media.
Exactly.
And people are pushing it.
Yeah, it's natural. Although I always say like arsenic is natural.
Yes,
okay, so let's talk about the first one, rosemary oil. And, one of the nice things about doing these deep dives is I learned stuff too. Now, I learned this a little bit the first time we did the scalp. I think it was a scalp episode. Rosemary oil, there's an active ingredient. It's called carnosine. Which is anti-inflammatory, antioxidant, but it actually decreases the enzyme. It's called 5-alpha reductase that produces. So the whole thing about androgenetic alopecia is you get testosterone that's made into dihydroxytestosterone, which is DHT, and that's what causes the miniaturization of the hair follicle. So we don't like DHT. We want less DHT. So this active ingredient in rosemary extract oil decreases this enzyme. So they did a head-to-head clinical trial with 2% minoxidil for 6 months, and it was comparable.
Okay, interesting.
So the thing about it is, if you're using rosemary extract straight up, you kind of smell rosemary.
Really strong.
But if you can take the active, this carnosine acid, or however you say it, carnosine, just take that part, extract it from the rosemary, and use that in a serum. I think that could be helpful.
Okay, so it's worth trying.
It can be. I don't think it replaces minoxidil because the other thing about all of these is they're small batches, it's small companies, whatever. Like, how do you know there's consistency in the dosage and all? There's all that aspect.
Okay.
It's not that these things don't work. It's just that they're not regulated and they're not studied rigorously.
But it might not hurt.
If you don't want to go to the drugstore and spend $100 on the Rogaine, you can try that.
Okay, I like it. Okay, and another big one is pumpkin seed oil.
Well, actually, I would actually use pumpkin seed oil more than rosemary, and I didn't know this, and I learned this from researching for this. So pumpkin seed oil has the strongest ability to reduce that enzyme that makes DHT. The 5-alpha reductase. And actually, they did a study. It was a randomized, double-blind control. So good study.
I know what that is. Yeah.
76 men with androgenetic alopecia. They took 400 milligrams of oral pumpkin seed oil. Are you listening to this, Ryan? Going to get on some pumpkin seed oil daily for 24 weeks, and they got 40% increase in hair count compared to the placebo.
That's wild.
I was kind of blown away by that.
That's pretty impressive.
Here's the other cool thing about pumpkin seed oil.
Work for men or women, obviously.
Both, yeah.
Yeah.
But a handful of pumpkin seeds, how much protein do you think is in that?
Oh, no idea. It's
like the same as having an egg.
Oh, wow.
So I was starting to train for one of our hikes, I wanted to, as you get older, you need to make sure you get the protein.
100%.
And I'm not great at doing that. So I have a bowl of pumpkin seeds, and I have it all, and my staff have it too, because I'm like, if you eat a couple handfuls a day, it's like you have a chicken breast.
Nice.
Yeah. Okay. So, and now on top of that, it's good for
your hair will be
good for your
grow
hair.
back.
I think that makes more sense to me than putting rosemary extract in my hair. To me,
yeah.
You've got double whammy there with the protein and
and the hair. Yeah. And
so eat your
growth.
pumpkin seeds.
Okay.
It's good for you.
Okay. What about palmetto?
So saw palmetto it comes from a plant. It's a First Nation herb, I think, that use the berries. Another thing that decreases that enzyme 5-alpha reductase. Okay. So you get less DHT. Okay. So all these things reduce dihydroxytestosterone. There was a systematic review in 2005 looking at saw palmetto and pumpkin seed oil together. It showed quite promising increase in hair density. So I don't know I didn't review what exactly the product was, but I think it's fine. I think there's some concerns with saw palmetto in men in particular that it can mask prostate cancer because if you take it regularly, it can decrease the DHT. And it's actually was first introduced for men as a natural supplement if they had prostate growth. Like,
wow.
It's called benign prostate hypertrophy. Men's prostates can grow as they get older, and then they can have problem going to the bathroom. So saw palmetto was sort of first suggested as a natural supplement to help that.
Okay.
But there's some concern with it. I don't really recommend it anymore. People ask me, again, I think I'm going to recommend pumpkin seed oil.
Yeah, far that sounds like it's the winner.
The winner.
Okay, the last one I think is, what about castor oil?
Yeah, so I'm sorry to listeners, there's absolutely zero evidence that castor oil promotes hair growth. What it does do is it can increase the luster of the hair, the shine.
Right.
So I think it makes you think that your hair is looking better, but there's no evidence for growth. Like, people put it in their eyebrows and, like, it doesn't grow hair.
Okay.
Sorry, it doesn't.
Okay. Sorry about that.
Yeah.
Okay, so let's move on from things that you're going to like either put on your scalp or ingest and talk about red light therapy and PRP and like all those different things that people use to grow hair.
Well, PRP is kind of when you get to the doctor's office. So let's start with again, we discussed that in the hair episode, but let's do the combs, laser combs. So there's a comb called Hair Max laser, which is actually FDA approved for hair loss in the US. Didn't know that. It's expensive. You got to use it every day. So there's some evidence that low red light therapy can stimulate the hair bulb.
Yeah.
And they also pull the hair a little bit. So hair follicles are stem cells. So that means they're constantly producing, right?
Okay.
So if you pull it a little bit, if you have red light, there's in the studies that I reviewed, 40 to 50% of hair counts increase. The main thing is you got to do it every day. It's not like 2 seconds, right? So it's time. It's money to buy the thing.
Yeah.
So again, I think there's a lot of evidence for other things over this, but if somebody asks me, I say there's some science.
Okay, but what about when I use like the Ducray serum? I'm massaging it in because I always thought you want to bring blood flow to that area to increase like the
delivery. Good point.
Yeah.
So I mean, you can use the comb then. I mean, like, you can do all of these things together. You could spend 2 hours, like, what's that guy, Don't Die guy, Brian Johnson. Like, you could spend 3 hours on your face and hair and put everything that we just talked about. I don't have time for that. So it depends on, we're kind of trying to give you all the options and the science. But yes, you could definitely put your Ducray serum on. I
actually do it fast. I do it fast. I give a little massage as I'm like, I put it in, a little massage. Yeah. I don't know.
I'm a bad patient.
It can't hurt, right?
Most doctors are very bad patients. You know that,
That's so true.
Right?
That is so true.
Yeah.
Okay, so let's talk about when you really need to see a doctor. So when you really, a shed is one thing.
Well, any woman and men too. Like, think about my son's friends that are 20, were 23, 24 at the time. Anybody gets freaked out when they have a hair issue.
Sure.
So
because hair is everything.
Everything.
Yes.
But when you really want to be, and it should be intuitive, but if you have pain, if you have like big scabs, you have pustules, your chunks of hair are coming out outside of the shedding aspect in the shower and things.
Sure.
But I mean, there are some very uncommon causes of hair loss that can be scarring, which means you lose your hair forever. And those are urgent. You do need to see a doctor quickly. And it would be very helpful if we know that as dermatologists, this patient is having a lot of pain, they're having a big rash, pain and itch is something. But it's hard to sometimes tell, like, people have minor symptoms and they're freaking out. So the point is, it would be great to see a dermatologist. It is harder to see a dermatologist. A lot of derms don't see hair because it's such a prevalent ask that it takes up a lot of our clinic time. Then we can't see skin cancers and things like that.
Sure.
So that's why it's great to start these things and have this knowledge before you get to the doctor.
Yeah. And to try some different things. And it sounds like we just recapped a little bit the pumpkin. I mean, why not try the pumpkin?
Pumpkin seed, have them on your desk.
Yeah.
Munch away.
I think that's so
and
good.
when we see a patient in clinic, what I do is obviously we take a full history.
Sure.
We do labs for thyroid, iron. Sometimes I'll check vitamin D. Some people have very low vitamin D.
Sure. Well, especially in Canada.
In Canada.
I mean, I everyone I know takes it every day.
I think it's good too. And I don't think it's because we're not getting enough sun. I mean, part of it is where we're not, because we live in Canada.
Right.
It's not like during the summer, you don't need to bake yourself. It's because so many months of the year, we're not in the sun. And then I'll often do a scalp biopsy. Okay. I find the scalp biopsies are helpful because it tells patients exactly what's going on. It gives them an answer, because people want an answer. And you can't tell, like a lot of stuff's happening under the skin. We need to look at the hair bulb. You can't do that by looking at the scalp.
Sure. Okay.
So we do that.
Okay. So should we finish with a little rapid fire?
Yes, I think you have some crazy things to ask me that I'm not sure
Well, there's
about.
always crazy things that people are trying. Because...
But you get them off of social media, and then you just ask me them, and I have to. Go ahead. I'll see what I can do.
Just ask the questions. Okay. Onion juice.
Onion juice. Okay. That would be no skin to it, so not skin to it. But I think there was a study once in alopecia areata where people get the bald spots. That's the autoimmune condition. No. The answer is no.
So it's not skin to it.
No.
What about garlic chili? Like a spicy scalp
So I'm
massage.
assuming you're trying to irritate the skin to increase blood flow. No studies, nothing that I came across in my literature search. So that would be no.
Listen, I think we already kind of covered this, and I think I know it's no skin to it or not skin to it is the castor oil.
Yeah, definitely no. I mean, for luster, but not for growth.
For luster, but luster's not bad.
No, it's not bad.
Luster's not bad. How about like hanging upside down? I saw this, but it's so funny.
What did you say? Hanging
upside down and massaging your head so that the blood is like flows to your head. I saw this all over, and people are like, "Do it for 2 hours." Who has 2 hours to massage?
There's no evidence. There's absolutely no evidence for that. Okay. I think it's great for your lower back pain, like those
which I have
tables,
as well.
Those tables where you go. Like the stretch tables?
Hang and stretch.
Yeah.
Okay, so that's not skin to it. And then this sounds like such an old time, something people did like many years ago, brushing your hair 100 times, like 100
No,
brush
that's actually
strokes.
an old myth, and that can increase damage and breakage. So, again, that's kind of, I guess, like the pulling of the hair is stimulating the hair follicle.
Okay.
But again, there's so many more better things to do than that, and you can damage your hair.
But what about, I've seen so much, and I've almost purchased it. There's become this resurgence of really good hair brushes.
Yes. So a hairbrush that is I actually, I forget the name of one. The hairbrush can be helpful in stimulating the follicle a bit and not damaging the hair.
Okay.
But again, it's not necessarily, I mean, potentially with a bit of, you're pulling the hair very gently.
But is it also, can I ask a question? What I kind of thought it did is sort of take like the natural oils that are in the scalp and then kind of like run it through the hair.
There's one that I recommend. I can't remember the name of it. Maybe we'll bring it up in the men's episode, but yeah, that's not bad. I mean, you want to get a good brush.
Yeah.
Yeah.
Okay.
And you don't want to brush your hair when it's wet. Like you want to be careful with it.
Right. That's another thing.
Yeah.
And
or
also
sleeping with wet hair.
No, I never do that. Yeah. I hate that. Okay. Collagen supplements. I mean, listen, whatever, I have a feeling it's good. So I put it in my coffee every morning.
Collagen supplements have been shown in limited studies, small numbers, to be good for the skin. I take it in the morning, my coffee. Yeah. We both do. But there's not a lot of evidence for hair.
I take a true marine collagen.
Yeah. There's not a lot of evidence for hair.
Okay. But okay. So hair growth shampoos.
Yeah. So I think the Anaphase line is great. Traditionally, like the shampoos are not strong enough on their own to grow a lot of hair. They support other things. We've discussed that in detail. But if you want to use a shampoo line, use one that has some science behind it, which is this one.
Which is the Ducray. Okay. So that's a skin to it on that.
Yes, skin to it on that.
Okay. Just a few more. Well, we talked about essential oils. So
pumpkin seed oil, rosemary extract.
Yeah. Okay. Wonderful. So that would be skin to it.
Into it.
Microneedling rollers at home. So people are sort of like you would microneedle your face, you're rolling your hair and then putting like a serum on.
Well, if you're putting a serum on, that's different. But just microneedling straight up, I mean, I know that some people do that to increase, and some of my son's friends asked me about this because they take deep dives on the social media. And there's these guys who like microneedle and then they put the Rogaine on. It increases the absorption. Again, it's a lot of time, it's a lot of effort. you got to make sure it's sterile. You got to make sure that you keep the thing clean.
Right.
It's not something I recommend. I don't think there's any studies showing increased results that I know of.
Okay.
It's not a no. It's proceed with caution.
Proceed with caution.
Yeah.
Okay.
Yeah.
And I actually did this a scalp facial.
Right. Yeah, we've talked about these before.
Yeah. And you know what? Listen, it was very relaxing, and it felt great, and my hair looked great.
Right.
And
Again, it's going to be lusterful, shiny, and all that, but there's not a lot of evidence, and there's not a lot of studies showing any of that stuff. So
that it helps, like with regrowth.
I think it's great
that.
for self-care.
Okay.
Not necessarily your hair.
Okay. And I think probably the last one is just like hair elixirs, or like these different teas that people are drinking to hair.
Yeah, again, I
growth.
think, maybe if it has some pumpkin seed oil in it, it has some rosemary extract in it, maybe some castor oil. I don't know what those would be. I think, again, they would all be supportive. Maybe a little bit of self-care. You're going to have tea anyway. But
not poison ivy tea.
Not poison ivy tea, no, definitely.
So we talk about that in another episode.
Yeah, there is people who actually drink elixirs that have poison ivy.
Right. Yeah. So if you're going to drink a tea, just watch what you're drinking.
Yeah. So I don't know which ones you're referring to, but I think if they have some of those active botanicals that we talked about, it's not a bad thing.
Okay. I love it.
I think we did. Good questions.
Okay. So that would be sort of a skin to it, but proceed with caution. For a lot of things.
Well, thank you very much for listening today. I think it was a great episode.
Amazing.
Be sure to follow us and subscribe and review if you can, because it helps us bring you the content that you love. And we'll see you next time on Skin to It.
Thank you. Thanks for listening.
Catch us every Thursday for a fresh, exclusive dose of Skin to It. And don't forget to subscribe so you never miss out on the skincare wisdom. We will guide you through the maze of skincare and cut through that noise to help you achieve your healthiest skin. Loving our podcast? Share your thoughts and help us grow by leaving a review on Spotify and Apple Podcasts. Until we meet again, see you soon on Skin to It, your guide to healthy skin.